have a lot of great information to cover tonight. Thank you, Sam, for coming on. And before we begin, if you can share your background, that would be great.
Sure. Yeah, I'm a licensed naturopathic doctor here in Montana and in Washington State. I'm in Montana today. So, and I've been studying and practicing clinical or medical herbal medicine for about 16 years now. So, went to Bastyr University for pre-medicine studies to finish off my undergraduate studies and study herbal pharmacy, herbal sciences, and a lot of other sciences, and then went into naturopathic medical school there at Bastyr University in the greater Seattle area. In 2015, it's almost been exactly 5 years since I started my clinic. After working hard for other people, I decided I could put in just a little bit more time and effort and do it for myself, so, and my patients.
Excellent. Yeah. So you have posted, I follow your posts and you've posted several times. I want to touch base on this tonight. I think it's really important, especially as we move into the discussion of COVID-19. Please explain the difference between a naturopath and a naturopathic physician. So being back east, when you say an ND, people are like, what? What are you talking about? What are you, a shaman? Right? And one of the things you wrote before is, listen, I'm not an osteopath, I'm not a chiropractor, I'm an ND. So and explain that difference, what an ND actually does compared to like a naturopath, because we have some people who consider themselves naturopaths, but there is a striking difference.
Yeah. So naturopathic medicine has been around for, it's 2020 now, March 2020, almost April. And it's been around for about almost 200 years, really. And if you go back into the history of the United States and medicine and medical schools, there are chiropractic medical schools in the 1800s. There are naturopathic medical schools. There were other kinds of medical schools like osteopathic medical schools and allopathic medical schools, which is like your conventional MD school. And then in 1912, the Flexner Report came out, where one of the Rockefellers charged a gentleman, Mr. Flexner, who was a politician, but he was also a research scientist out of Johns Hopkins University. And he had a disdain for a lot of practices around like psychiatry of the day, in the 1800s through into the early 1900s when he came out with his report. But he also was going around and shutting down conventional medical schools, chiropractic medical schools, naturopathic medical schools, and creating, because he was of German descent, a more rigorous but also more streamlined way of doing medical school. So what we see today, even in the chiropractic schools and naturopathic medical school and conventional medical school, you have 2 years of your sciences, and then you have 2 years of your clinical ologies, your pulmonology, your cardiology, et cetera. And then you have your clinical aspects. So in conventional medicine, that's pharmacy, pharmaceuticals. In naturopathic medicine, that's herbal medicine, counseling, nutritional medicine. So the science around nutritional medicine. When you study cardiology, you don't just look at, well, what pharmaceuticals do we use for cardiology? You look at what nutritional medicines, what botanical medicines are used for what conditions, what dosage, and what contraindications, et cetera. So whereas you have like a monograph for a pharmaceutical, we would study those, but we would also study the monographs for botanical medicines. And we would talk about like motivational interviewing, because as you know, we have patients that most of their conditions are caused by lifestyle habits and choices that have become ingrained into the unhealthy lifestyles, which has created most of their disease conditions. And working with motivational interviewing, we're able to help them unravel that and replace those bad habits for healthier habits over time. So we would learn things like that. We would have clinical rounds, and what basically happened in the split in naturopathic medicine is that there were people, I believe it was around somewhere around the 40s or 50s. I don't remember exactly when it was. I think it was before the 1950s. And there was a big group of people in naturopathic medicine that wanted to have no regulation, if you will, like didn't want to go into like a classical 4-year medical program modeling kind of after what happened in 1912 with the Flexner Report. And then there was a group of people that wanted to have the rigor and the academia and get a doctorate degree and say, we are doctors of naturopathic medicine. So there's this giant split within the community, and there's still a giant split. And there's a big difference in the training too, because if you go to a school online that says they're a naturopathic practitioner, they are not getting the rigorous training that we get with having supervision from other licensed practitioners. They can't order lab reports, they can't do blood draws, they can't do certain procedures. And similar to chiropractic doctors, it's state by state dependent upon what we can and can't do. So I'm licensed in Montana and Washington State, as I mentioned. The licensure could be different if I move to Arizona than it would be in Montana and Washington State. And there are laws state by state. So in some states, I may be able to do everything, including, like platelet-rich plasma injections into different parts of people's soft and tissue, as well as like trigger points or something, as well as into joints. In other states, I might not be able to do that. For example, other states in Montana and Washington State, I have extra certification to do IV nutrient therapy. So we'll get into what that is and how that can benefit people in their immune system. But basically, it was a group of people wanting to remain practitioners, but not be doctors bound by a license. And so those people are getting like mail order degrees where they do like maybe a 6-month training that would be more analogous to like being a certified health coach and or herbalist, which there's nothing wrong with that. However, that's vastly different than going to a 4-year medical school and taking 25 to 35 credits a quarter and doing like cadaver dissection and studying biochemistry and learning the biochemistry of like plant science and herbal medicine and counseling, and having supervisors say, this is how you make sure you don't kill somebody. So I would say it would be like somebody's going up to a chiropractor and saying, are you a massage therapist, versus are you a doctor of chiropractic medicine, and do you know the anatomy of the spine and the limbs? And I know I have a lot of chiropractic friends like you, and who are chiropractic doctors, and in some states chiropractors can adjust different joints of the extremities and draw blood and look at labs, and in other states they can't. So that's kind of the way it is for naturopathic doctors. And going back to Dr. John Bastyr, who Bastyr University is named after, his dad was a pharmacist and his mom was like friends and I believe an administrator at a chiropractic university or college in Seattle back in the like 1930s or something. Maybe it was even before that. And so he was brought up being very integrative, and he believed that there was a time and place for all medicine. So naturopathic medicine, we've kind of trademarked what we call the therapeutic order, which functional medicine also likes to use sometimes, which is, if somebody breaks their femur skiing down Big Mountain here in Whitefish, Montana, I'm not gonna try to like reset their femur in my clinic and just say like, go home and take some arnica
Surely.
homeopathy pellets, I'm gonna say go to the hospital. But if they come to me 6 weeks later and they're like, I fractured my femur, I still have a lot of pain, I now have low back pain because the way I have to sit, then maybe there's some things that I can do to increase their quality of life, potentially increase healing time, and combine with whatever surgery, or maybe they need to have a plate put into their hip or their femur from that fracture. Then they could increase healing time and maybe not have to take as many NSAID medications, which, as I mentioned in older posts, can decrease things like testosterone. And even lately, they've said that can make you more susceptible to coronavirus. So
yeah, they were talking about the ibuprofen, and because I was just reading a report today, I was listening to another podcast, and they were saying the ibuprofen is a possible one, but a naproxen sodium may have some antiviral agent to it. So if you had to take something, they were talking about maybe we should take the naproxen sodium, not the ibuprofen. I just, you know what, they don't know. They don't. They don't know. I mean, I'd more in line go back to this kind of natural stuff we use if you're not infected, but yeah, it's changing on the ground, not by the hour, but by the minute. It's absolutely bonkers. So I want to ask you, is naturopathic, I know you said, naturopathic doctors can do something different in each state. And chiropractic, like you said, it's the same way. When I tell people, no, I had to go through gynecological rounds and we had to do dissection up for 30 weeks, they look at me like, but don't you just crack a back? And I always say, listen, you can teach anybody to manipulate a joint, but it's more important to know when not to. That's really what's most important. I know the guys that you hang with, I'm sure, feel the exact same way. So I know a naturopathic doctor is licensed. Is a naturopath licensed, or they're just not licensed?
No, they're not licensed. So the nomenclature that we use is we're naturopathic doctors. Some states use naturopathic physician, but if someone just says they're naturopath and they don't use doctor or physician, then they are not licensed. You can ask if you're in someone's office and they say they're a naturopath, you can say, hey, can I see your naturopathic medical license? And I have to renew my license every year. I have to get, a ton of continuing education unit hours that I have to pay, a fair amount of money for to stay up on my training. And usually I go above and beyond that. So that includes like paid webinars from home, flying to cities and doing extra training in areas of your specialty or interest. And there's also required hours around things like pharmacology, ethics, because we do have prescription abilities. So, I can prescribe a lot of legend medications. I can prescribe testosterone. I have a DEA number, which when I call the compounding pharmacy and they say, can I have your DEA number because I want to make sure that I'm talking to the right doctor, then I give them my DEA number and I have to pay for that every 3 years. It costs almost $800. So there's a lot of things that a naturopath won't be able to do for somebody that a naturopathic doctor or naturopathic physician will be able to do for somebody, because they have a medical license. We have to have malpractice insurance, just like you do, just like a medical doctor does. And then every year we renew our malpractice insurance, and they ask us like, do you do IV therapy? Do you do this? Do you do that? And then your malpractice insurance goes up if you do more highly invasive things. So just like it would for any kind of doctor. So, we're part of the medical community in Washington State. The governor of Washington State basically made it state law in the late 90s. So that's over 20 plus years now, that naturopathic doctors acupuncturists, and massage therapists all were able to bill insurance. So that's something that they fought for years. So there's ability for doctors to bill insurance in states like Washington State, Oregon State. And as a practitioner, you can decide if you want to bill insurance or not. Unfortunately, the way insurance has gone over the years, I used to work.
Not really worth it.
And then, yeah, it's not. So there's no, in the insurance world, there's no parity. So basically what that means for naturopathic doctors is that, let's say I bill for a return office visit code and it's like a 99214. So it means it's pretty high complex patient. You know, I work with adults, so they're more likely as they get older to have more problems. Then the insurance will say, okay, well, we would reimburse a medical doctor $125 for that visit, roughly. But since you're a naturopathic doctor, we're going to reimburse you about 40%.
Right. Yep.
And we spend more time with the patient, and you know, they're not really reimbursing for extended visit codes. So it's not really advisable, I think, in this day and age in 2020, for if there's like a naturopathic doctor coming right out of school today to start billing insurance, because they're just not going to be able to feed themselves.
No, not at all. We have the same thing in chiropractic. I mean, they really just, you know, you guys just did a whole examination, orthopedic, neurologic, biomechanical, height, weight, blood pressure. You jumped through all the hoops, and we're going to give the guy next to you, we're going to give him $75. We're going to give you $17. You know, you know, it's absolutely craziness. I would say the same thing to anybody coming out of chiropractic college. You know, save yourself the aggravation, keep your overhead low, and, you know, just go enjoy life. Don't get insurance, and, you know, just, you know, do what you want to do, service the people. So thank you for explaining that, because I know you often wrote quite a bit on your posts the difference between, you know, naturopathic and a licensed naturopathic physician. So using your knowledge, we have to talk about today's current events. And as COVID-19, we would be remiss in not talking about this as doctors, to lend some sense of calm, to lend some sense of direction for our patients. So let's go over, if you can, the demographics of, you know, who's really exposed, who we're worried about the most from our 60 and older, our cardiovascular, or diabetic patients. Let's talk about that.
Sure. Yeah, that's a good question. So the high risk category is really people with at least 3 medical diagnoses. What I mean by that is not like something like what we talk about in functional medicine, like leaky gut, but something that if they went to their hospital would be in their chart as a medical diagnosis with the ICD-10 code attached to it in the United States. So heart disease, congestive heart failure, any kind of heart disease, any kind of lung disease. So COPD especially is what I think about, or asthma, active asthma. So COPD is chronic pulmonary diseases. So chronic obstructive pulmonary diseases, which means like emphysema, which is like one of the key ones we think about, where they lose elasticity in their lungs, and there's damage to the alveoli. So this particular infection really loves the respiratory tract, and that's where it goes. So we'll talk more about the virus in a minute, but so if there's any lung stuff, or let's say somebody is just acutely immunocompromised, they've had the flu and they're run down, and then they are going to be more likely to contract this virus, which are 2 different viruses. The other conditions that come to mind are diabetes. If someone has hypertension and they're on like angiotensin converting enzyme inhibitor medication, that can have issues, because that's how this virus works. It works on the whole angiotensin converting enzyme there. So it works on ACE.
What about ARBs?
I think ARBs are more okay. I believe, I mean, always talk to your doctor, talk to your cardiologist, talk to the prescribing physician, but Calcium channel blockers might be better for people. And, this has been kind of in the debate in the scientific community around like, are ACE inhibitors bad? And it was kind of like a coin toss a couple weeks ago. And now the literature is saying it is a concern. So if someone is taking an ACE inhibitor, I would go talk to your prescribing physician and talk to them and say, hey, I'm concerned about this. Let's see if we can switch up to a different medication. I usually don't.
We're not telling anybody to come off their medication.
Yeah, please do not.
Please stay on your medication.
Do not do that after this. Yeah, and for that matter, for all supplements right now, if somebody prescribed you a regimen of supplements or herbal medicines or hormones or whatever your regimen is, keep it what it is.
Right.
Do not change anything just because you heard on this live today or another one, or you read something on social media.
However, we got to talk about that because there are a lot of murky I'm being very polite right now. People are doing the COVID-19 marketing for supplements and vitamins, get your supplements and vitamins to build your immune system. And I think you have to be extremely careful. You don't know what you're buying. They don't know what medicines you're on. You don't know how they will interact. So that's super important. Even when we're talking about, herbal extracts, because you talked about this before, that you have to be really important where you're getting those herbal extracts from, the potency, how it can interact with your meds.
Yep.
So be careful.
Yeah. And I had to take a whole extra course in my undergraduate training. It basically was almost like master's level training in botanical medicine. And I took a whole course in herb-drug interactions or drug-herb interactions, depending on who you are and where you stand. But basically, we've been using botanical medicines for thousands of years since, the first primate jumped out of a tree and chewed on some leaf and found that it could do something for them. But these pharmaceutical medications have severe interactions, drug-drug interactions with each other, as well as drug-herb interactions. So if you're taking a bunch of things and you haven't had them all kind of checked off by multiple physicians, potentially you may need a lot of people in your corner if you have a lot of different conditions. So if you're a smoker, you're also at high risk. There's been like some viral video going around of some lady, I think she had a British accent, couldn't really tell, but she was in the ICU and she said she was a smoker. She looked young. She looked somewhere around age 40, and she had coronavirus and she had an IV in each hand. And they had like basically, sewn those onto her hands so they wouldn't come off. And she had a cannula, oxygen, and she was just warning people to stop smoking because it's going to make, it kills the cilia in your lungs, so you can't kick up your viruses or infections that go into your lungs, but also dust and other things that might get into your lungs, because the ciliated epithelium in your lungs are moving things upward, including things like mucus every day. And when you smoke, you just kill off all the cilia. So they're like little hair-like projections that come out of your lungs, your lung cells, and they're supposed to be there. So yeah, smoking, we already know is bad for us, but people still do it because it's very addictive. Not good if you are wanting to stay healthy and not get, influenza too. Influenza A is still killing a lot of people, especially elderly. When my grandparents were still alive and actually grew up in northern New England, about 20 minutes away from them, they would always ask me, are you healthy? Have you been sick in the last week? Okay, if you've been sick in the last week, you're not coming over for dinner. So they were smart enough to know, like, okay, like we have friends that are getting really sick and dying from influenza, and we don't want to get really sick, because when you're older and you get pneumonia, up until about 5 or 10 years ago, that was like the third or fourth leading cause of death was lung disease. So You know, that's still how people die from influenza, and that's how people are dying from coronavirus, is pneumonia basically drown from your lungs, and you can't breathe. Yeah, so those are the, you know, and diabetics, type 1 and type 2 diabetics are high risk because
Obesity?
obesity. If people who have especially morbid obesity, which is a BMI of 40, I believe, and plus, which is, that's significant. I mean, you're carrying around a lot of weight. But even if someone actually, you know, has, you know, 30 plus BMI, you're higher risk. I would throw in untreated autoimmunity, so especially polyautoimmunity, where you have more than one autoimmune disease that's not really being treated by what we would call like a root cause treatment plan, and they're just trying to rely on some of those medications that basically suppress the immune system. Maybe if somebody's been on prednisone for a long period of time, which you should not be on prednisone for long periods of time, because it can cause things like osteoporosis, and decrease your bone mineral density that way. And then you can fracture your bones. But also it's going to suppress other things, like potentially your immune function during this pandemic. So the issue is coming into this pandemic is we had a very unhealthy population in the developed countries of the world.
Right.
And from what I've read from other medical professionals, is that our population is more closely related to Italy's population. And with the amount of unhealthy elderly population, these patients are on multiple medications, they have multiple diagnoses. They're not coming to see people like you and me. They're going to go see their medical MD specialists, because that's the people that they've been seeing for probably years now. They're on at least 5 prescription medications, and they might not even know that these drugs are interacting with each other because nobody's checked them for years. So we've had this very unhealthy population for a long time, and now we have a virus that is able to basically turn off your innate immunity by way of getting into your lungs, and it basically it's like turning off the police department and fire department for a city and saying, we're going to just start like burning down block by block, right?
Fire
and it just keeps getting in there.
Yeah,
and you know, it takes building after building. And what we're doing right now is we're saying we don't have the hospital personnel and we don't have the supply chain of medications, whether they be antiviral experimental medications, but also we just frankly don't have the hospital beds.
And we don't have the PPE either.
Yeah, exactly.
Right? So personal protective equipment. I know
Yeah,
we're going to talk about. I know we're going to talk about immune system. Howard just asked about NAC and acetylcysteine. You know, I have not been using it as an immune builder, but I think, in my opinion, please jump on if you are having something. I know it helps with respiratory is when I best would use NAC. I did get a bottle for the just in case. How do you use NAC in your practice?
Yeah, it's I see it as a biofilm buster for infections of bacteria in the gut and other parts of the body. It's also great for the liver and the lungs. So anybody who has any lung issues, I usually give them N-acetylcysteine. We're calling it NAC here. N-acetylcysteine, for people who don't know, helps you increase your own production of glutathione. And a lot of people are talking about glutathione on social media for when they have an active infection. And I just want everybody to know, I was looking at a lot of different things today. Rhonda Fitzpatrick just sent out this great email. So if you're on her email list, she sent out all the conventional research. You can go to the New England Journal of Medicine. You can go to the National Institutes of Health. there is, quote unquote, no conventional research trials on any natural medicines for coronavirus, the SARS-CoV-2 or COVID-19 infection. So there has been no research on this particular virus, but we have 3 other coronaviruses that cause SARS, and they're all in the same family. They're all RNA viruses, like influenza A is, which is why they have to make a vaccination every year for influenza, because the RNA viruses mutate and they're harder to deal with than a DNA virus. So it's a bigger ball of wax to deal with any treatment. The good thing with natural medicines, which is a fact, is that viruses and bacteria, from what we know at this time, they don't have a resistance to a treatment. So if you're working with a practitioner and they say, this is your antiviral formulation to take it how they say to take it, and take it until they tell you to stop taking it, and then stop taking it. Right. But what we do know is that these viruses, these RNA viruses, when they do find a conventional antiviral, they do get used to it. So that's what we've seen with HIV, which is a RNA virus. And it's a lot more complicated. I'm trying to make it simple for the audience, but we've seen the HIV drugs fail, which is why they released one, I think it was like 6 years ago now, for like, it was like insanely pricey when it first came out, like something like $60,000, and then they kept dropping the price.
I remember that.
So I think that was like 2013, 2014, around there. But yeah, NAC, usually good to help with cilia, help with the lungs and the liver, help with glutathione production on your own, because when you take glutathione, you're going to stop making your own glutathione. So usually I recommend people take NAC, especially if we do like one of these advanced tests that we do as functional medicine practitioners, like an organic acid urine test. And then with the organic acid urine test, you can see, like, does this person actually need NAC?
Right, because I don't use NAC as like, here is your regimen, take your NAC every day like you would take your vitamin D, unless there's an underlying pathophysiological presentation. I don't use N-acetylcysteine like that.
I don't either. Yeah, and I don't recommend people take it ongoing unless you have an actual lung condition. Right. Or if you had bronchitis and you're still getting over bronchitis, and it's like, okay, let's take NAC for maybe 5 weeks or 4 weeks.
Just what it does.
And then you stop. So I was just listening to and watching a couple of videos on, I think it's called like MedCram and Biomedical Doctor.
Yeah, he's got great stuff.
He's awesome stuff. So they did a research trial with coronavirus with 4 of these monkeys that are mostly similar to us genetically. And what they found is that after 28 days, there was no virus. And they did like an anal swab and a nasal swab. And they found that these monkeys didn't have it at the end. And they did, at different stages of the trial, they did autopsies on 2 of the monkeys, one at the end of the 28 days and one, I think, halfway through. But what they found is that the virus got into the lungs, got into the pharynx, the throat. It got skeletal muscle,
heart,
lymph, spinal cord.
Yeah.
It causes a lot of weakness and pneumonia. And we've dealt with these things medically before with natural medicine. So I'm actually reading a book right now, and I'll just tell people the title. You can get it on Amazon, called Herbal Antivirals, Natural Remedies for Emerging and Resistant Viral Infections, by Stephen Herod Buhner. So last name is Buhner, Buhner, and he also wrote Herbal Antibiotics. And he has a section about SARS and coronaviruses. And this book was written and published, and copyright is from 2013. So Herbally, you can argue that there's no quote unquote research, but if you know the pathophysiology of a disease, so that goes back to like, why would somebody want to get a naturopathic medical doctorate degree or a chiropractic medical degree? Well, we take things like pathology, and when we read a book like herbal antivirals, or we read research online, we can understand the language. There's a certain nomenclature that when I was in undergraduate studies studying botany and plant science and other things on my own, that I couldn't read the research that I can read now with further education. So it's about education and knowing how to read this stuff, which some people can do self-taught, but not everybody can do that. So what he says is that there are a bunch of herbs that you would use at different stages of the infection, and we know that it basically spikes around 3 days. Fever and cough are some cardinal signs and symptoms, and vitals rather, of so having and potentially low pulse ox. So if you are in a hospital or you are meeting with a physician and they take your pulse oximeter rate and you're getting some hypoxia, that could be a red alert sign, like, hey, it's time to be on oxygen. But basically, cough and fever are some of the cardinal signs that you're not going to get with like a common cold. So a lot of people who are saying like, oh, this is just like a weak flu or common cold.
No,
it's just not the case.
And shortness of breath too, right? So
yeah, shortness of breath, which you're going to have when you have hypoxia, because your body's trying to get more oxygen, and there's been damage to the lung tissue where you're having oxygen exchange, similar to what happens with influenza A, but it's a different mechanism of how the virus is getting into the body.
We have to touch base also on the fact that in the rhesus monkey study that they did, it also showed up in the gut. So some of the presentations that are happening now is this onset of diarrhea, and then it gets lumped in. Oh, this person just has some diarrhea, some irritable bowel, but that in itself could be a symptom of this new SARS-2 presentation as well. So I've been reading a lot about that. And you mentioned before that you like to use N-acetylcysteine, for biofilm. Do you work with ever use biocidin, ever use any of that in your practice?
Yeah, I think biocidin would be a great way to go with this. And I would couple it with things like lomatium, red root, which is Ceanothus americanus, also called New Jersey tea, because they use it during the American Revolution as like a red tea that is also good for the lymphatic tissue. And we know this gets into the lymph and the spleen. And in autopsies that they've done, they've shown damage to the spleen and the lymph nodes in the lungs of SARS. So they're researching a Chinese herbal medicine formula from the SARS epidemic in the early 2000s in China right now. They're doing research trials on it. So we also have research trials like open label with azithromycin and the chloroquinone, and that that guy is doing those videos.
Yeah,
Medcram, thank you. The Medcram guy, he did a video on March 10th that you can pull up on YouTube and watch about zinc getting deeper into your cells with chloroquinone diphosphate, or chloroquinone phosphate. The problem is this medication, since everybody knows now that it's used for COVID-19, with especially beneficial with azithromycin, which is like a Z-Pak, there's some issues because that's an antibiotic. And if you've ever had sinusitis and your MD or your nurse practitioner, primary care practitioner gave you a Z-Pak, that's azithromycin. And you could be having some antibiotic resistance to azithromycin already. So I'm personally not a big fan, of course, of using antibiotics, but if somebody, were to call me up and say, hey, I got bronchitis, I already have asthma, I'm on, my insurance covers every medication under the sun, I don't want to get pneumonia, I'm high risk, I'm, even in some cases, people are high risk at 55 plus. If they're, 50, 55 or older, then, it may be a beneficial idea to exercise caution and get them on the azithromycin. It's short term, this is, I believe it's in less than a week, like 5 days. Yep. And then the chloroquinone is dosed high the first day, and then it's like 2 tablets the first day or 2 capsules the first day if it's compounded, and then it's 1 capsule a day, I believe, for 5 days or 7 days thereafter, 7 days total. So the issue though is that there's a supply issue. So you're talking about like with the masks and things like that, there's a supply issue with masks in the hospitals because a bunch of idiots were like stealing masks and from hospitals and freaking out. And we need these for the healthcare practitioners who are in the front lines. So if anyone has like an N95 mask hanging around, donate it to your hospital. Most likely, if you're staying home, you're washing your hands and nobody is sick around you, you don't need a mask.
Right. And here's the thing, most of people have no idea how to properly put on a mask, right? So
yeah,
that's so they're buying the N95 mask, and they don't know how to properly put on the mask, which is absolutely, I find that entertaining. So we got another question here. So Howard is asking, so is it okay, in your opinion, for long-term to use N-acetylcysteine if somebody has COPD? Would that be something that they would take on a daily basis?
The research trials, I believe, for COPD have shown some improvement. And I believe, I don't remember how long the trials were. I believe it was around 10 or 12 weeks. So the short answer is we don't know. The long answer, I would say, is I would give it to somebody with COPD long term, but I would also let me back up for a second. The other thing is patients tend to run out of things and then not reorder. To keep a consistent schedule. So if I tell somebody, hey, stop taking that, they're going to stop it probably for a month. But if I say take NAC until I tell you to stop taking it, they'll stop for 2 to 7 days on their own because they'll run out and then they'll reorder. And then let's say right now NAC might be on back order, they'll get it 5 to 12 days later. They've already taken a 1 to 2 week break. So, which is usually what you want to do with some supplements like NAC or some herbs, you want to take a 2-week break. So clinically, things aren't always like the way they are, especially in research where it's like, oh yeah, we did this for 12 weeks and they were also taking this, and then we made sure they were doing this, and a
lot of variables.
Yeah, there's so many variables. So for a short answer, I would say yes, take long term. For long answer, I would say talk to your healthcare practitioner. But there's a lot worse things that people are doing for COPD. And I used to work and volunteer at the end of high school in a ER in northern New Hampshire, and there was a ton of older patients coming in with COPD, and we would do the bronchodilating treatment for them. That we would have to sit them upright with the pillows behind their back and have them nebulize these medications to bronchodilate. There's also other things that can help open up the bronchial passages, different herbs, and even drinking things like yerba mate, which is like a South American tea. So that's a bronchodilator because it has theophylline. Theophylline was a very old medication at higher potencies than you'll get it in yerba mate for things like asthma as a bronchodilator. So, but yeah, people are oftentimes overdosing on their inhaler, and that's causing other issues systemically. Right. So I think as far as, NAC, as long as you're not taking like 1,000 milligrams 3 times a day, you're doing like 500 twice a day or 3 times a day, and you're not maxing out the dose and you're checking in with your practitioner, that's fine.
So we know we're getting close to the hour, believe it or not. It goes by so fast.
Oh wow.
Yeah. So did you read the paper by Masterjohn? Did you see his paper, Chris Masterjohn?
Was that the one about remind me which one that was?
He just put it out about, listen, you really don't want, the high vitamin D, you don't want the high vitamin A. Pretty much against all that, afraid that it's going to modulate the immune system, just upregulate it too much. That was his thought process on that. So we're hearing different things that you shouldn't take vitamin A, you shouldn't take vitamin D, take vitamin C, the IV infusion vitamin C. We're hearing some good reports on that. So to wrap it up, let's just briefly talk about what an individual can do to build their immune system, just to make it a little stronger. We know, obviously, stop smoking if you're smoking, lose some weight, start walking, start exercising. We all know what to eat, what not to eat. So putting all that aside, what can someone do now? What, should they run out and buy vitamin C? Because you look at like our dispensaries, vitamin C is like
gone.
Run amok.
Yeah, yeah.
Zinc, gone.
Well, that's the thing. I mean, even for things like zinc, vitamin A, vitamin D, like I use Fullscript, I think you do too. Yep. And I was checking last Tuesday, they were already running out in back order. They may be replenishing their stocks. But I think this is an individual thing. I mean, public health is not individualized medicine. So we can't go out on social media and say everybody should take zinc, elderberry, high dose vitamin A, high dose vitamin D, and call it good, and just like, say, okay, cool, like everybody, good luck, just have at it, buy it all up, and make these supplement companies rich. The point is that it's case by case, and you could have somebody that has certain conditions like kidney stones or something. Like I have patients that have that, and I have to be very careful. Sure. It's max 1,000 IUs of vitamin D to 2,000 IUs a day, and typically 1 or 2 days off a week after that, so that it doesn't kick up their kidney stones based on their genetics and their constitution. So if you are reading online that, hey, vitamin A is good, oh no, now this research says vitamin A might be bad. Elderberry was good last year for everything viral. Now it's bad. I will say, I would say for elderberry, what I've read a ton about elderberry in the last week. So elder is a tree. It actually grows in the Mediterranean. It grows in Italy. I've been there. I've been to the herbal medicine farms where they're growing black elderberry, and the bark and the leaf is actually been shown to be great for these SARS-like coronaviruses. The berry is great for H1N1, which is like a strain of influenza, swine flu actually, which came out, and we had swine flu in 2009, if you remember that epidemic, where people were dying and freaking out too. And influenza A and H1N1, elderberry is great for those. Early on, if somebody's starting to like get congested, feel maybe a little bit not like themselves, maybe swollen lymph nodes in their throat, cervical lymph nodes or something, that's a good time to take elderberry. But if you are in like the throes of the signs and symptoms of coronavirus, that's the time to stop taking elderberry, from everything that I've researched, and look into like, okay, I need to call a practitioner and get on a Zoom call with them and figure out a different protocol, or maybe mix up what I'm doing with all the things I already have at home. IV vitamin C, great, but in Washington State, the governor said no face-to-face, non-mandatory visits with health practitioners for 90 days last week.
Oh, wow.
So where I used to do a lot of IV vitamin therapies for patients, and I just found that in downtown Seattle, people didn't want to come to downtown Seattle with their busy work schedules and family schedules and sit for an IV, which is, if you think about it, is part of the reason why people are sick, is they're just too busy to get better or take care of themselves. But I do know other IV clinics, but they're only doing IVs for like cancer patients right now. They're only doing IVs for like the very essential people. But if you start to get sick, or you're worried you might get sick, you may want to schedule an IV immune boost formula that the practitioner will know how to do for you. You want to make sure they have extra training in that. Not all naturopathic doctors are trained in that. So, or medical doctors or any kind of doctor, that's extra training. But IV vitamin C has great research for viruses like H1N1 and coronaviruses and things like that. Like anything in medicine, the sooner you can take care of it, the better. You don't want to wait until you have pneumonia.
Right.
And I've had pneumonia and it sucks. And I was trying to get through my first year of medical school with pneumonia in the beginning of my spring quarter of my first year. And I can tell you, it sucked. You feel like you're dying because you almost are. And, if you can, do all the hygienic practices, don't wash your hands so your skin is ripping off your fingers, but wash your hands and use lotion. Put a humidifier in your bedroom if you live in a dry climate. Maybe put some eucalyptus essential oil on that. And if you start feeling like, hey, my lungs are feeling a little weaker, but I don't have a fever yet, maybe start doing some steam inhalations of something like eucalyptus or just 1 to 2 drops. In the beginning, eucalyptus is helpful, but once you're already sick, it's not going to do a lot. So essential oils, I think a lot of people get a little too excited about essential oils out there. They're helpful, but they're not going to be helpful again if you already have a fever and you're starting to get bronchitis and on your way to like a deep lung infection, which is what coronavirus is. It's a deep lung infection.
And I just want to say on that deep lung infection that, where a lot of times we see the upper respiratory tract infection here, I think we're seeing the lower tract that's involved. And that's what makes this so different than the other ones, you got the flu. I mean, now we're getting this lower tract involved. And look, a week ago, 2 weeks ago, elderberry, we seeing on the internet, elderberry is going to cause a cytokine storm. It's not going to cause a cytokine storm. It's still a good solid supplement to use, right? Relax, So, we learned so much tonight. I really, really appreciate it. So I'm doing telephone consultations. I'm virtual consult. You do virtual now. How can someone get in touch with you? And talk briefly about, the Live Strong, it's really important people can get onto your website. You can get onto your Facebook. Follow you on Instagram. Can you just throw it out so we got that?
Definitely. If you're on Facebook, go into the groups of Facebook and then just type in Live Strong, 2 words, and that's the men's only Facebook group. And we got men in there, adult men all over the world, and we're all supporting each other to be healthy, active, and optimize our hormones, our overall health, cardiovascular health, all of it, sexual health. And we talk about men's health problems that are really just more about being men, creating community, because there's not a lot of community for men today. And then I have a group called Apollo Health Tribe, 3 words, Apollo Health Tribe. So you can look for that in the Facebook groups and join there. That's men and women. So any women listening can join there, and men. And I posted a bunch of different links about coronavirus. There's one from like UCSF about mental health during this, because I know some people feeling like locked up in their homes, especially California has mandated everybody to stay at home. So if that's making people feel kind of squirrely, you can look at those resources, and it's all free. So there's no like membership dues to sign up for those groups. On my website, I have a podcast. It's called The Dr. Mideira Show. It's on iTunes. It's on Spotify, iHeartRadio, et cetera, all the platforms for podcasts. So if you want to listen to a podcast about something not having to do with coronavirus, about men's brain health and men's hormone health, I have 2 more podcasts coming out this week. So stay tuned for those.
Excellent. So I can't thank you enough. This was great. Learned a lot of great information. I appreciate you taking your time out of your busy day. I know you're still working hard. So listen, I look forward to somehow seeing you in the future. And of course, I will talk to you soon. Thank you so much.
Thank you. Appreciate it. Take care, everyone. Bye.
Yeah.